Yes, yes, yes. Welcome to the Michael Koolidge Show. Koolidge.com is the website. Koolidge.com. That's spelled with a K. We're on Facebook. We're on Twitter. Our email address is radio@Koolidge.com. radio@KOOLIDGE.com. I am overwhelmed with the amount of questions and comments that we've got for our guest coming up right now. We are extremely excited and honored to welcome on to the Michael Koolidge Show, the Surgeon General of the United States of America, Dr. Jerome Adams. Dr. Adams, welcome onto the show.
Glad to be here with you today, Michael.
Yes, I know so many of us are rooting for you and everyone on the coronavirus task force, and we are extremely impressed with the press conferences every day and keeping us up to speed on stuff. And if you don't mind, and I know you've been doing this on a lot of other outlets, we can get right down into the questions a lot of our listeners have. But before
let's do it.
All right. So the biggest one I know right now is the mask question. What is the bottom line on the mask situation? Do we have enough of them? And when we eventually will have enough of them, do you recommend perfectly healthy people wear them out on walks or on short trips to the grocery store? Do they do any harm? And in what circumstances would a healthy person not wearing a mask be bad? And finally, any general guidelines about homemade masks?
Great question, and I appreciate the opportunity to clarify. Originally, the World Health Organization, the CDC, and my office all recommended against the general public wearing masks because based on the preponderance of the evidence at that time, we felt that masks did not protect the person wearing the mask from getting COVID-19. We still feel that that is the case. But here's what's changed. We find that now about a quarter of people who are transmitting COVID are transmitting it before they have symptoms. So there's asymptomatic transmission going on, and therefore is reason to believe that having people wear a mask may prevent transmission of the disease. The CDC is studying this issue, but here's what's most important for people to know. Number one, it's important that you wear a facial covering properly if you're going to wear it. So if you touch your face while you're putting it on, if you touch your face while you're out and about, then you may be transmitting disease from a surface to you. So wash your hands first. Don't touch your face if you're going to wear a facial covering. Number two, leave the N95s to the healthcare workers because they're not going to be more effective for you than they are than a cloth facial covering.
And just to interrupt to clarify, our listeners, the N95 ones are those like white masks that literally say N95 on the package. They're like made for medical professionals. Exactly.
And our concern is that if people take those N95 masks, they're taking them away from a healthcare worker who almost certainly will be more likely to be exposed to COVID or to be transmitting it from patient to patient. So save the N95 mask for the healthcare workers. And then here's the most important thing. The most important thing is if you wear a facial covering, that is not permission to go out in public. The most effective way to prevent spread of COVID is to stay 6 feet or more away from other people. And so it's not a substitute for social distancing if you do decide to wear a facial covering.
That's a great point. So the bottom line is, as
the president said, we aren't opposed to people wearing a facial covering, but you need to understand that you're doing it to protect the community. You're not doing it to protect yourself. You need to wear it properly, otherwise you could put yourself at higher risk, and you shouldn't take from the medical supply.
Yes, my wife keeps emphasizing that to me. She's a physical therapist who wears a mask every day, and she's still seeing patients, physical therapy patients. It's like it's to protect other people from you. It's not to protect you from other people. And a lot of people might think if they wear a mask to the grocery store and their friend's wearing a mask, they can talk to each other a foot away and give each other hugs. No, that's not the case, right?
Exactly. It doesn't mean you can go out and do the things that you were doing before. The countries that have been able to really slow their spread, even the ones that wore masks, it was also coincident with them having aggressive social distancing in place, really staying at home. And that's the most important thing that people can do right now. And that's why we put out those extensions in the 30-day guidance from the president, calling on people to avoid unnecessary travel, to stay at home, to work from home if they can.
And just one more question about the mask thing. Is it safe to say then that if the coronavirus disease wasn't so easily transmittable through asymptomatic people, that it it would still be the case that masks among the general population for healthy people would not be recommended.
That would still be the case because they do not protect the wearer from getting the disease. What the big difference here is that we're seeing that there's more asymptomatic transmission than what we thought. So we've always told people, if you're sick, wear a mask so that you don't spread disease to other people. The problem is with COVID, many people don't realize they have the disease, so they don't know that they're sick.
Okay, because that was, I know, a trust issue some people brought up. Well, wait, are they saying this because they want to keep the masks for healthcare professionals, which is a completely reasonable thing to keep these N95 masks for healthcare people. But no, it was about the asymptomatic transmission, the extent that that existed, which we didn't know as much before.
Exactly. The reasoning and the reasoning and the recommendation is still the same. We just may be adding to that based on asymptomatic transmission. So we want people to understand we always make the best possible recommendations to the public based on the preponderance of the evidence available at that time, but we aren't afraid to shift our recommendations or to look at them if the evidence changes.
I've seen pictures of people creating homemade masks, and is there any cloth or material that you recommend they do not use? My wife is allergic to blue dye, and I'm like, all right, we shouldn't be making anything with a blue dye, although she has her own medical mask. What is there any general guidelines on things to avoid if you're creating your own mask?
Well, what I would say, if you create your own mask, the most important thing is to make sure the substance that you're using is clean, and if it's paper, that you throw it away and make a new one. If it's cloth, that you clean it, because what we don't want you to do is to wear a mask and then go out in public, sneeze in it, cough, bring it back home and put it in your pocket and think that you can keep using it over and over and over again. Again, you, in that instance, could be essentially creating a petri dish of virus that you then bring to your house and expose yourself to. So cleanliness is the most important part. But beyond that, don't use the material you're allergic to, obviously. But feel free to make your own facial covering or use a scarf if that makes you comfortable. But know why you're doing it and know how to do it properly.
And we shouldn't shame people walking around yet if they're not wearing masks at Walmart, right? That guidance has not been put out as of today that everyone should be wearing any sort of face covering publicly. Is that accurate?
That is accurate. The CDC is still looking at the data to try to figure out if this is the most appropriate direction to move into, as is the World Health Organization. It's a complicated issue, but again, you're not protecting yourself. If you do wear it properly. Don't take away from healthcare workers.
Okay. Moving on to testing. Now, we've been playing and listening to the coronavirus task force briefings every single night. We play them a lot on the show, so we're kind of up to speed on where we are with the testing kits from Abbott Labs. Just trying to look a little bit into the future. Do you see any future conditions where it would make sense for literally everyone in the country, even people who are healthy, who wants to get a test to get tested? Would that eventually make sense, do you think?
Well, here's the thing. When we do surveillance, we don't test everyone for anything. There's not a disease out there where we test 330 million people. What we want to do is make sure we've tested enough people in the community that we feel like we've got a good sense of the amount of spread or disease burden in that community. And so most people think that's somewhere between 1 in 100 people to 1 in 200 people. The other thing we want to make sure we can do is anyone who has symptoms needs to be able to get tested promptly and needs the results back promptly. And that's why we're excited that we have this new Abbott test that returns results in 5 minutes, and we're ramping that up in addition to 100,000 tests per day, because if we want to reopen the country, we need to be able to quickly identify cases, to isolate them, and to follow up on contacts. And so, again, there's diagnostic and there's surveillance testing, but even surveillance testing doesn't mean everyone across the country gets a test. We don't do that for strep. We don't do that for flu. We don't go out and just randomly test people and say, here, let's find out whether or not you have it. We test symptomatic people, and we also do surveillance to make sure we understand what the burden is in our communities.
Okay, because I think there's this perception among people that, we're going to have these drive-through tests soon, and basically everyone who wants one's going to be able to get one, and then that'll be like a social thing that everyone's going to ask, hey, did you get tested? Oh, you didn't get tested? Or they're not invited to our party. We don't know whether they have coronavirus or not. There's this human survival thing, I think, and psychological thing where we all want to know if we have it or not. And
here's what I would add to that. There's always unintended consequences because we know that you can test negative, but then 2 days later have coronavirus because it just hasn't multiplied enough in your system that you test positive yet. So we don't want people to get a false sense of security. But the other thing is, if we can get through this season by social distancing, then if it comes back, we have every hope that we're going to have a vaccine next year. And like I said, we don't just go around randomly testing people for flu. We tell people to get your flu vaccine to protect yourself so that then when you go in public, you're less likely to get it or spread it to others. And that's where we hope to be with coronavirus in the future.
Yeah, that's a really great point, listeners. People think, oh, are we going to shut down the economy every time there's another coronavirus in the future? Not if we have a vaccine. You know, we don't shut down the economy for the flu because we have a vaccine. And hopefully we'll have one in the future. And speaking of these tests, will the tests, as you understand them, be able to determine if you did have the coronavirus months ago and you were just asymptomatic?
There are antibody tests out there that are being ramped up. Again, it's important to have those from a surveillance standpoint so that we can understand, okay, this is how many people actually did have the disease in the community. It's also important for our healthcare workers because if people have been exposed, then we feel much better about sending them to the front lines than people who haven't been exposed. And then finally, it's important for us because there's convalescent serum as a potential therapy where we take the blood from people who have recovered from coronavirus and give it to people who are sick with coronavirus. So there are definitely uses for that antibody testing. But again, that's not a test that we're going to administer to 330 million people. That's a test we're going to use in a targeted way to better inform our responses from a therapeutic point of view and from a public health standpoint.
We are speaking with the Surgeon General of the United States, Dr. Jerome Adams. He is an anesthesiologist by trade and was appointed to become the Surgeon General of the United States in 2017. And we're so extremely honored and thrilled to have him on our show answering your questions, listeners. CNN reported on a group of doctors who wrote this paper claiming that the coronavirus could be spread by airborne means. And that's a rumor, I know, or a factoid that's being put around on social media, meaning by, simply people standing in the same vicinity and breathing the same air. Can you comment on that at all? Is that true?
I can comment on that, and I've actually talked with Dr. Fauci, who I consider the top virologist in the world. And here's what he said. When we think of respiratory diseases or diseases that spread like that, we think of diseases like measles, where if one person is standing on one side of the room and you're standing on the other side of the room and you haven't been vaccinated, there is a greater than 90% chance that you will get measles because it spreads through the air. The study that people are talking about is one where they really forced the person to have a deep cough, a deep sneeze, and they saw how far those droplets could be shot across the room. That is not a normal situation. If you come into a room, if you're out in public and someone is just hacking or coughing loudly, move away from them.
Yeah.
Stay away from them. And typically, if you stay far away from them, then you will be fine. Most people are not going to be exposed to coronavirus if they stay 6 feet away from someone. So the primary means is droplet transmission, and the primary way to protect yourself is staying 6 feet away. If someone just breathing the same air that they are, we still believe that there is very, very, very little chance that you will get coronavirus, unless, like I said, there's someone hacking and coughing wildly, and they shouldn't be out in public, and you shouldn't be around them anyway.
This question is one I haven't heard elsewhere, but is really important. My college roommate has coronavirus, and so does her husband. He is in the ICU, intubated and fighting hard for his life, and she has very mild symptoms. Are they keeping track of the demographics as they relate to the severity of symptoms, and why does the virus affect so many people so differently?
Well, that's a great question, and we are still looking into that. Again, new and evolving virus. But when you look at demographics, even in the United States, we still see that the risk of complications goes up precipitously with two things, and that's age, over 65, and that's comorbidities, diseases like heart disease, lung disease, diabetes, or being immunosuppressed. And so we suspect that a lot of these cases that seem like one-offs are, when we look at them, look backwards at them, a lot of these people are going to have underlying conditions that either we didn't know about or that they didn't know about. There is some suspicion out there that because we have so many people, young people in particular in our country, who report vaping in the last 30 days, that may be a contributor, or using marijuana and smoking marijuana, because this is a respiratory disease. So if you're doing something which can cause inflammation or damage to your lungs, then it's going to put you at higher risk. But there may be other reasons. We know that we're a sicker country. We're not as healthy as the rest of the world. We're more obese. We have more high blood pressure. We have more cardiovascular disease. And so at the end of the day, if you have other underlying disease, or if you're older, you're going to be more likely to get sick. But we're still learning about who does and who doesn't get sick with this disease.
We're speaking, by the way, with Surgeon General Jerome Adams, listeners. And somebody asked about retail pharmacists. Are there any extra precautions they should be taking? People are still going to their Walgreens and their CVS's to pick up their prescriptions. I mean, there's a lot of people I know in retail who are exposed to strangers more than the rest of us are in society. But pharmacists in particular, anything about them that they should be following, Dr. Adams?
Well, pharmacists, delivery workers, the cashier at your grocery store, please say thank you to them, because they are literally out there risking their health to serve you. That's number one. Number two, what we tell people is wash your hands frequently. Make sure you're practicing social distancing to the extent that you can. When you're going to visit your pharmacist, you still want to maintain 6 feet of the money and the materials that you're getting. And just make sure within the pharmacy you're washing down surfaces frequently, and that, again, you're practicing good hygiene.
Any idea how long it lasts on surfaces?
There are studies out there that suggest that it can last hours on surfaces. Some studies that suggest it can last for days, but you have to understand the virus can die and you can still detect RNA several days later. So right now, what we believe, based on the most available information, is that it can live for several hours on surfaces. And that's why you want to be careful with doorknobs, touching rails, and then touching your face. Make sure you wash your hands when you come back in from public. Make sure you take off clothes and put them in the washing machine. Come back into the house, or before you go around the rest of the house when you come back in from public.
Are there any long-term effects that we know of after you've had it? Somebody who's had it, they've gone through a bout of it, they've been treated, but they came out on the other side healthy. We've been reading things about your lung capacity is diminished for the rest of your life, or at least it was in one person's case. Anything we know right now is because it's such a new disease, we don't know about the long-term effects of it yet.
Most honest answer is we don't know. We're still learning. But important to know that 80% of people have mild to moderate symptoms and don't need medical treatment. And those people seem to fully recover the same way anyone else who got the flu or a bad cold would fully recover. Of the people who need medical treatment, that other 20%, most of those people still recover. In total, 98 to 99% of people worldwide are recovering from this disease. But the damage can come if you end up needing to be on a ventilator, or if you end up needing intensive treatment. And it's not that the disease itself is causing a long-term damage in many cases, so much as it is the treatment that you need is so aggressive and intensive that it can cause longer-term damage. We're still learning, but important to know that most people, the lion's share of people, will recover. A lot of people don't even know that they had it.
I know we only have a couple minutes left here with Dr. Jerome Adams. I want to squeeze in as many of these as possible. I have one listener who said she just wanted to express her appreciation for the great job you are doing dealing with this and the entire coronavirus team. The frequency of education you guys are providing American citizens in these crazy times is admirable. All the many media outlets and education and reassuring that you've been doing, we're all noticing it and we're thankful for it. And how are you personally doing? I mean, are you sleeping at your office? Are you getting your rest? Or are you able? I mean, you're doing all these great, really important and informative interviews, but do you have time to do your job the rest of the day? A lot of people worry about.
Well, we're trying to make time. The good thing about me is that I worked at a level 1 trauma center for the last 10 years, And so I'm used to working 24, 36-hour shifts, and my body has kind of adapted to it. But I also try to make sure I find time to sleep when I can, that I eat healthy, and that I try to exercise whenever I can. And so all those things are important now more than ever, because we know the healthier you are, the less likely you are to get coronavirus. And the one thing people can do, two things people can do to help me: stay at home so there's not so much spread, but then go to coronavirus.gov and learn about the facts, because I'm still just one person. But if every single one of your listeners is spreading the positive information, the truth out there, then that makes my job that much easier. And hopefully we get through the end of this a lot more quickly.
Coronavirus.gov, listeners, coronavirus.gov. I apologize I didn't get to everyone's questions. We did this as fast as we could. And Dr. Adams, Surgeon General of the United States, we cannot thank you enough for not just coming on the show, but for doing everything you are doing. Anything else you'd like to add before we say goodbye?
Well, social distancing doesn't mean social disengagement. You still can go out and give blood, make an appointment first. Use Skype and FaceTime to check in on people. Check on your neighbors and make sure they don't need groceries, because not everyone can get out. And then finally, call your mother. She wants you to, and she needs it now more than ever. So just do it.
I think that was a personal one to me, because I have not called my mother in a couple of days, and I think she deserves it. Dr. Adams, thank you again for coming on to the Michael Koolidge Show, and Godspeed. We're all praying and hoping that this ends sooner rather than later.
My pleasure. We will get through this.
All right. We will be right back on the Michael Koolidge Show. Stay with us. Hunting for Connections is dating for outdoor enthusiasts. Hunting for Connections is not just for hunters, it's for people who enjoy all outdoor activities, and particularly people who are looking for love. Hunting for Connections has your match already narrowed down to someone who loves hunting, or fishing, or geocaching, camping, off-roading, running, racing, winter sports, summer sports, extreme sports, etc. Pretty much anyone who loves the outdoor lifestyle. Easy first date ideas, right? Sign up today at huntingforconnections.com. That's huntingforconnections.com. Hunting for Connections. It's the place to hunt for your connection.